My name is Kathleen Lill. I am the director of Marist College Physician Assistant Program, and I want to welcome you to our Allied Health building. This building opened in January of 2016, and we are thrilled to be here. There are 4 teaching spaces for the PA program in the building. We occupy half of the first floor and the basement. They include a lecture hall, a skills lab, a 10-based skills lab for our students, a traditional gross anatomy lab, and a simulation suite made up of 5 clinical exam rooms and a 2-bay trauma lab. We're happy that you're here to take a look, and we can't wait to show you what we have. This is the PA classroom. It's designated specifically for this program. We're the only program that uses this classroom, one of the largest lecture halls here at Marist. So the idea behind this room is the tiered seating. We can no longer build a permanent amphitheater classroom. So what we've done is actually created this amphitheater seating where the tabletops rise so that everybody gets a good eye on what's going on. In this classroom, we can also flip the tables up and move them out of the way so we can bring patients in gurneys into the center of the room. A lot of variation in room setups and a lot of versatility. We also have a full podium, 2 screens that come down, a lot of coverage in this room. So it fits our needs to a T. It's developed for 60 students, so the classroom is designed to handle the maximum potential for this program. This is our skills lab. This is a 10-based skills lab. Each section is set up for students to work in teams of 3 or 4. Here's where they will learn their diagnostic skills, physical diagnosis. They'll move up into more focused diagnostic skills. We'll also do clinical skills in here like suturing, splinting, and casting. This is Harvey. Harvey is a heart and lung sound trainer. He hails from the University of Miami. He's been involved in medical education for a long, long time. He's the first technical mannequin our students will be involved with. And Harvey is a way of teaching pathological heart and lung sounds to students, not only what they're going to hear, but where they're going to hear it. There's a teaching stethoscope. There's 10 infrared scopes, so we can train students to placement and pathology. This mannequin is hooked up with ultrasound, CAT scan, and echocardiogram, so they can actually see anatomical pathology and associate it with the sounds. As they move from here downstairs to the simulation suite, they'll be working with much higher tech mannequins and be able to see what this pathology looks like in terms of a presenting patient. We're now down in our simulation suite. We have 5 patient exam rooms. So in these rooms, students will work with standardized patients, and those are patients, members of our community who've been trained to be patients. So students will be able to interact one-on-one, get patient histories, do focused physical exams. This is a very realistic environment. We require a tremendous amount of healthcare experience for acceptance into our program. So it doesn't make sense to train students in anything but a realistic environment. So in this room, as you can see, it's outfitted as any exam room in the community would be. The difference is we have one-way glass here so that faculty can be on the other side as opposed to in the room with the student. So it's just the student and the patient, faculty on the other side, and then we also have audiovisual capture in this room so that students are able to assess their performance along with faculty members in terms of assessment and remediation. This is the gross anatomy lab. We have 11 tables here to accommodate, again, a maximum number of 60 students. Our donors, all of our donors for this lab are whole body donors who come from the Association of Medical Schools in New York State. Each table has its own AV system. There are video cams as well to capture pathology on each donor. Students are hooked into the network as well to use their own dissectors or to research pathology. It also allows the faculty, our faculty members, to broadcast and disseminate information to each table. So gross anatomy in our program at this time is taught during the summer term, the 12-week term. It's a lecture series accompanied by 2 large labs each week. Our students are allowed to work in this lab. They have access for unsupervised time, which is before or after class and weekends as well. They're allowed to be in this lab up until midnight for unsupervised use and extended study.
Hi, welcome to Marist College Simulation Center. My name is Robert Scott Bostwick. I'm the simulation specialist for the Physician's Assistant program here at Marist. We're standing right next to SimMan 3G, the most advanced mannequin that we have. SimMan 3G is a very unique mannequin as it offers the students a range of capabilities that you would not get on a normal patient. The mannequin will tear, salivate, sweat. Its pupils will respond to light. It talks. It has a full range of pulses like a human being does. It has heart sounds, lung sounds, bowel sounds. You can take a blood pressure on it. You can start an IV on it. A unique thing that the 3G has is a drug recognition system where the mannequin will recognize the drug that's being pushed, how much is being pushed, and have the appropriate physiological response to that drug.
So thank you for taking this tour with us. We appreciate you taking the time to take a look. Should you have any questions, anything we can help you with, please feel free to contact us. We look forward to hearing from you.